Hello, and welcome to our question of the week. This week's question relates to plan of care requirements. We have a question related to whether a plan of care is required in two different scenarios. Scenario 1. Agency goes out to assess for admission. Patient is appropriate for admission. Entire assessment is completed, and provider is called for the verbal order for services. Either the provider refuses and we can't locate another signing provider, or provider agrees and later refuses once POC is sent. Either way, we don't have a signing physician. So, we would not need a plan of care for billing purposes, but we are divided on whether we need a plan of care for condition of participation reasons. Since we did make one or several skilled visits, would we still go through the process of creating the plan of care as if we were going to send it out? We can still handle the technical pieces within our EMR of not sending it out and discharging the patient and writing off. Or would we change the patient to not admitted and not create a plan of care at all, knowing there is no provider to sign? Scenario 2. Similar to Scenario 1, we made a couple of visits and then found out the patient was active with another agency. We don't plan to bill, so would the POC be necessary just because we did provide skilled visits, or not needed at all? This week's question is answered by Victoria Barron, a clinical consultant here at HPS. The answer is as follows. While you would not need a plan of care for billing, as no signature will leave you not being able to bill, you would need one for treatment provided, assuming that you documented a verbal confirmation of the plan to provide care. You would be covered for care provided. For Scenario 2, to support compliance with the conditions of participation, you should develop a plan of care and have it signed and dated by the physician despite not billing for the services. Additional criteria that must be met to be compliant for billing and the conditions of participation is as follows. For home health benefits to be covered, the following criteria must be met related to the plan of care. According to Medicare Benefit Policy Manual Chapter 7-30.2, services are provided under a plan of care established and approved by a physician or allowed practitioner. Surveyors do not evaluate whether services were billed or not billed. Do you have a question for our clinical consultants? Join our HPS Alliance. For more information, visit healthcareprovidersolutions.com/HPS Alliance. Remember to like, share, and subscribe to our videos so that you don't miss future questions of the week, Monday Minutes with Melinda, and more.